Great. And we're going to get started here in a minute with Terry Moore.
Do I have a mute here? Where's mute? Here? You're sure?
If you could mute yourselves, there will be some times for us to talk later, but as you're coming in, if you could mute yourself, that would be great. My name's Kevin O'Connor, and I run the Center for Nonfiction, which is affiliated with Columbia University. It is my pleasure to welcome you tonight to the BlakeSt House. We have an ongoing series here of speakers that have that come to talk about various projects, mostly books, but also just things that we really think are very interesting. My co-host and partner in crime in this is Stephen Morrison, the former publisher of Picador at Macmillan, and also former editor-in-chief at Penguin. I think something like that. Yes, he's waving. He's saying yes, yes, yes. So thank you so much for having us. And I'm really, really appreciative tonight to introduce Terry Moore, who's become a great friend in the last couple of years. Terry is the founder and CEO of HomeoLux. Terry is a business philosopher. He has been a lifelong leader in science and research. He came out of retirement to launch HomeoLux, a health and technology company that designs wellness products based on cutting-edge science, which we're going to talk about today. The company is Terry's answers to his wife's Alzheimer's diagnosis and dedicated to battling this cognitive decline. Terry is also the founder of the Radius Foundation, a forum for exploring and gaining insight from different worldviews. He serves as a member at the Columbia University Center for Radiology Research and has popular TED Talks that examine how to master even the most simplistic skills in life. And I can honestly say this man retaught me how to tie my shoes. There's no time that I tie my shoes now that I don't think of Terry Moore, and I do it the way that he taught me. So I am much appreciative. And on that note, let me take it away, Terry.
Kevin, thank you. What a great pleasure and honor it is to be here. And what a great introduction. Thank you so much. I'll be here for the next hour or so. Topic which I think is important to all of us about brain health, brain science, what's disease, and what's hope. And there's a lot of hope we can talk about. I'm sorry, have I been muted? Have you
we could hear you.
Oh, all right. Got a false flag from my computer. So let's just talk about the evening for a few minutes. The purpose is clearly to connect with one another. And I think this is a wonderful forum for doing that. And I hope we all use it as much as we can, because that's why we're here. In this process, we hope to understand each other and some of the issues that were being discussed. It is an environment of respect where all voices and points of view are welcomed. And we encourage everybody to contribute and to partake and engage in this dialogue with us, because we all know, and I think it's been the BlakeSt experience, that you really get more out of these things the more involvement there is. And hey, we're here for involvement. Okay, let's
share screen.
Share screen. Share screen. What? Here?
Mm-hmm.
What?
I'm sharing screen.
Yes. Here? Here?
Mm-hmm.
Share? Okay.
You got it.
We've got it. We're mastering the technology as we speak. Next slide. Okay, that's me. I'm Terry. Terry Moore by name. I have a very long history of being involved in a variety of different things. I'm one of those people who couldn't get out of college because I couldn't declare a major until the school declared a general studies major, and that's how I got out of college. My career has been long and varied and has involved science and biology and business and technology. And in the process, I've done a couple of TED Talks, which much to my surprise have been very well received. The one Kevin mentioned was the one on how to tie your shoes, which is something that I thought I knew how to do until it was explained to me. And then I turned it into a TED Talk, and now 8 million people have seen me tie my shoes. That's just a fact of life. The other TED Talk I did was about a question I had always had in linguistic and mathematics about why it is that the letter X was the unknown. Why is the letter X the unknown? Well, if you have 4 minutes, go to the TED site and I can explain it to you. But for the last part of my life, of the last few years, my focus has really turned to the brain and cognitive issues and problems of cognitive disease. And a few years ago, I came out of retirement to launch this company, HomeoLux, which is a health and technology company that designs wellness products that are based on cutting edge scientific research. And this company and this forum tonight, for that matter, are in some way an answer to and a response to my wife's diagnosis of Alzheimer's disease, which occurred in 2015. So we're going to spend some time tonight talking about Alzheimer's, talking about the brain, talking about science, and talking about the things that may be of real hope for the future. But for now, let's play a game. I think Kevin mentioned pencils and paper. You will need, before the evening is done, 3 pieces of paper and a pen or pencil. And this is one of 4 activities that we're going to do together this evening. And it's going to start in just a moment. What you'll need is 2 pieces of paper. You'll actually need 3 before the evening is done. And I'm going to show you an image on screen, and I'm going to leave the image before you for 30 seconds. Now, during that 30 seconds, look at the image and try to remember as many of the objects in the field as you can, but do not write anything down. You're going to look at the slide, and I'm going to give you 30 seconds. So, any questions? Everybody ready? Here we go. Did everybody see it?
Five seconds.
All right, now take a minute and using one of those pieces of paper, write down everything you can remember. We're going to take a minute to do this. Now, click.
30 seconds.
30 more seconds. There's the one.
All right,
No?
5
Go to
seconds.
the next one. Listening.
Pause. Stop.
Okay, time's up. Now, let's compare. Without referring back to the image, which I won't show you again, how many people could remember 10 to 15 images? Can we get an indication here? I see Kevin's remembered more than 15. There's another one. Shay has remembered more than 10 to 15. All right, how many people remembered 5 to 10? Hands, please, or a wave or something like that.
Can enter it in the chat box.
Chat box. Did I have to break that?
9, 11, some 8s, Dennis and Kim, Neil 9, Wendy 9, BB 11, Michael 10, Michael Evans 7. What else? Ben Silverstein 9, Michael I'm sorry, I'm going to butcher your name. McKay 11.
Here we go to
Fozia got 78 or 7 or 8. 8, she says. Linda got 10.
that's next.
I think everybody, it's those people's final answers. Anyone else? 9 from Alana.
Tear up.
Tear it.
Okay, now the thing to do is to take that list and tear it up. Just tear it up. Everybody got their list torn up? Excellent. Now let's talk about memory for a minute. I know that for a lot of older people, one of which is myself, sometime during the day, and I think almost every day, I will say to myself, what am I doing here? I walked in this room to get something. What was that? And you know, most of the time I can figure it out and get what I came for. Sometimes I can't. That's forgetfulness. And in order to understand forgetfulness and the difference between forgetfulness and cognitive disease, let's call on a computer analogy. The brain's often been compared to a computer, sometimes more successfully, sometimes less successfully, depending on the principle being illustrated. But this is a pretty good one, because what we're talking about here is what is called in the computer world user memory, operative memory, quick memory, not long-term storage, but working memory. Now, working memory in computers is defined by a number of parameters. One is that it tends to be small, and it tends to be what's called volatile, which is to say that the things in it can be replaced easily, and that it's on a first in, first out basis. And in many ways, our own working memories are very similar to that. This is different than long-term storage. We're talking about working memory, which is small and volatile, and for most people actually peaks at about age 25. And for most of us, we have a threshold of about 8 discrete items that we can operate in working memory in our healthy brains. And you know how these scenarios go very well. You come home from shopping and you put your hat out on the hook, and you put your keys somewhere, and you hang up your coat, and you take your packages to the kitchen, and you put things away, and you get a phone call from Bob, who says he'd like to meet tomorrow for lunch at the club at 12:30. No, make it 1:30. And will you bring so and so? And you finish that conversation, and you finish putting things away, and you realize that you actually need one more thing from the store. And then the question is, where are the keys? And you can't find your keys. And the way you would find them for most people is to go back to the door and try to come in again and mimic your motions. But forgetting the keys is forgetfulness. That's not cognitive disease. All of us have a limited size working memories, and we can overload them very easily. And generally, one thing to think about, or a quick rule of thumb to think about these matters, is that if you don't know where your keys are, that's forgetfulness. If you find them and you don't know what they're for, that's cognitive disease. But for most people, it's very usual for us to sometimes during the day not remember where we are, not remember what we're doing, or not remember what it is that we exactly set out to do. This is normal. Now, one of the reasons I brought out all of this information and went through this scenario is because it's kind of a little trick. I was picking on your brain because I was trying to put more items in working memory. And just as a little test, take out that second sheet of paper, having torn up the first, and I'm now going to give you 30 seconds to write down 5 things you had on your first list. Are you ready? Pencil set? Ready? Go. Ready? What comes next? This has to be next. Share. Are we ready? What slide goes with share? Same one. Okay, time's up. So, question. How many of you were able to recall 5 things that was on your first list? One, 2, 3. Shay again.
We got Kim, we got Mercedes, we got Michael, Rebecca, Linda, BB, Fozia, Dennis, Michael Evans, Rod Bigelow.
Good.
Jim Lohr has a comment. The hippocampus is the seat of short-term memory. Supposedly, the larger the hippocampus, the less likelihood of Alzheimer's. And we'll talk about, I think I'm going to store this question. We're going to come back to questions later about short-term versus long-term memory. Monty got 5. Aliana got 5. Fazia actually remembered more. Jim got 5.
Can anyone list 5 objects? Could one of our participants pick 5 to list? Fazia, how about you? You're probably on mute. Shay?
Yes, I'm on mute. I can list them.
All right. What do you have?
coin, leaf, clothespin, toothpaste, pencil, yarn, Band-Aid, and keys.
All right, good. Now, did anybody else come up with the same list? Or how about someone else giving us their version of the list?
Kim says spoon, eraser, egg timer, red string.
All right, many of those were completely different than Fazia's.
And bay leaf.
Oh, it was a
For
bay
number
leaf.
5.
Well,
Very, very
I'm impressed.
exact.
My God. My God.
Um, Dennis had nickel, pen, pencil, flower, bolt, dice, and Shay had pepper, hourglass, nickel, pencil, flower. Ben had yarn, egg timer, key, pen, pepper, leaf. Michael McA had pine cone, leaf, toothpaste, pen, nickel.
Very interesting. I hear some of the same items across the list, but what was your experience? Did it seem more difficult, or were the first 5 easy? Well,
Can people unmute themselves and answer? Or do I need to unmute people?
The 5 were easy.
good. 5 is a good size for working memory. It's an interesting experiment with the intervening data, because it's one thing to remember a short list, and it's another thing to do a complex activity that requires memory and then get back to the same list. And that was the point I was trying to illustrate about short-term memory, its volatility, its size, and how frequently it is that we can forget things and simply forget things. But that being said, let's talk about something different here. Because the world of cognitive disease, and particularly the world of Alzheimer's, is vast and deep and very, very complicated and very, very much a worldwide epidemic. Currently in this country, there are 47 million sufferers. The number is almost 50 million worldwide. It's more than that. It's almost 48 million in this country. It is the 6th most frequent cause of disease. Of people over 65, it is the 3rd leading cause of disease. For senior citizens, 1 out of 9 will receive a diagnosis of Alzheimer's. This disease is currently costing us more than $300 billion a year in Alzheimer's related expenses, and that is expected to go up to $2 trillion by the year 2030. So this is a worldwide epidemic, and Alzheimer's disease is also characterized by the fact that there is no cure and there are no survivors. It is a worldwide epidemic, and it affects, I was going to say everyone, and I believe everyone, because those who do not have the disease may have it in the family or know someone or be a caregiver, and it really is a disease that touches everyone. Approximately 2/3 of the caregivers are women, and it's a disease that seems to be more rampant in the African American community, with the incidence being as high as 14% higher, or in some communities almost 100% higher. So because of the prevalence, the impact, and the importance of Alzheimer's, and because there are no cures available, there's certainly a lot of research, but there's no cure on the table or in sight, and really only medications that deal with symptoms rather than the basic disease. So given that, I'd like to think about memory for a minute. And given that memory is important to all of us, I'd like you to take another minute. Actually, I'm going to give you more than that. And write down one of your most important memories. Something that you find important, personal, dramatic, or poignant, and write it down. Write a couple of sentences or a paragraph. That's what that third sheet of paper is for. But write something down that is an important memory of yours. I'm going to give you 5 minutes for this. So take your time and do it. Do it well. Begin.
So just for a clarification, this is a memory that you hold really precious and dear to you, something that you wouldn't want to lose.
Yes, a memory that's important or poignant, and certainly something that you wouldn't want to lose.
Terry, you're on mute.
Yes, I was on mute. We have another minute.
Okay.
I'm going back
We
to
thought we were missing nuggets.
no nuggets, I promise. All right, that's 5 minutes. Now, who would like to share one of their memories? I'd be eager to hear some.
Ben Silverstein, do you want to share? Unmute yourself and share. If you want to volunteer to share, maybe just put it in the text and I'll call on you. Ben, you there?
Yeah, I did put in the text already.
Okay, do you want to share it out loud?
Sure. I sent it to everybody, so follow along. One of my most important memories was when my daughter told me that I was her heart. It was during a conversation when her mother and I were separating, and we were talking about where she would live after the divorce.
Wow,
Good enough?
Yeah,
that's good.
a wonderful, poignant memory. Yes, could we have some more?
If you could just type your name in the chat box if you want to share, and we'll call on you. When do you want to go?
I'll go, yeah. It's interesting. I was thinking about this a bunch, and I kept thinking of memories about my mother, and I was also thinking about the memories she must have had that she's now not able to remember. And I was trying to remember my mother, you know, around age 15, 16, and what her memories have faded away. And I, in turn, remembered when I was 16 years old and my best friend taught me to drive a stick shift. And I remember just that feeling of being completely free, completely independent, kind of wild, kind of, you know, even sexy and rebellious and whatever we were doing. And I think that's a memory that I have that probably not many other people think of me like that anymore. And I'm sure my mom has those memories too, but she can no longer access them.
Wow. Neil?
Sure, I'll go. So my memory that is deeply ingrained is when I was probably maybe 5 years old, and I was with my mom and her friend in a park. They were having a picnic. I was along for the ride, and they were chatting it up, and I wandered off, and not far from where we were was like a lake, or it might have been a pond. It was some body of water, and I just went straight in. And I didn't know how to swim. I just went in and thought it was really cool. And I remember being in the water and turning around and seeing my mom in her yellow chiffon dress swimming toward me and ultimately rescuing me. But it was just this memory of her going through the water in her dress and coming to get me. And yeah, that's obviously a lot of memories are tied to trauma, and you know, that was a traumatic time. So that's what I have to share.
Thank you, Neil. Jim Lohr? Jim, you there? If you could unmute yourself, Jim. Jim, I think we're having trouble hearing you. Does somebody else want to share? We'll come back to you, Jim. Terry,
Yes, well, I have a story, and it's one of those things that I'll never forget, and it's Alzheimer's related. It was the day, not that many years ago, while having lunch with my wife, who had severely retreated into the disease. And she was really far enough into the disease that she didn't understand the phone call we had gotten that announced that the work that she had sponsored had just won the Nobel Prize. She knew that something happy was going on, but it was impossible to really share that moment. That's mine. Anybody else? Okay, thank you.
Michael Amato, if you could unmute, maybe we'll do one more.
Sure. Hey, everybody. My memory is basically after I graduated from college, I took 3 months to go backpacking through Europe. I was on a $3,000 budget, and all the memories and experiences that went with that were incredible. I went to England, Scotland, Ireland, Germany, France, Spain, and met with and stayed with my extended family in Italy for the first time. I made a lot of friends on the trip, and at the moment, the most memorable memory of that, the whole experience, was waking up in a random field that I had chosen to sleep in with a herd of cows licking my sleeping bag. So that's my story.
That's awesome. Thank you, Michael.
No problem.
All right, Terry, I think take it away.
All right, well, good. Alzheimer's is this terrible disease. And as I said, it's characteristic that Alzheimer's has no cure and no survivors. And because of that, and because it touches so many of us, the way to address it at the moment and the best hope for the future is to talk about prevention. And that's where science has given us some real hope. We'll get into the details soon. But prevention is an essential part of dealing with any health condition. And we all learned in the 80s and 90s about heart health and about the necessity of things like not smoking and getting exercise and sleeping well. All of these things turn out not only to be heart healthy, but also brain healthy. So let's talk about the brain for a moment and how it works. The brain has a trillion nerve cells. They communicate with one another across a gap called a synapse. They almost fit together, and it's the neurotransmitters, the electrochemical signals that move from one cell to another across this gap. This gap is called a synapse. And it's the synapse that is so important because it keeps all of the cells in touch with each other and regulates the function of the brain and the rest of the body and thought and memory. And these synapses all work one form or another with each other in a kind of harmony. And they're able to do that because they are so well designed. The nerve cells are covered with this insulator, this fatty sheath called myelin. And myelin is really the thing that allows the cells to maintain their electrical integrity. And nerve cells keep producing this myelin, and other cells called microglial cells, which are sort of the janitors of the brain, clean up the myelin as it is produced. And this is a process that goes on and on. And as important as myelin is to the healthy function of the brain cell, there are sometimes things that go wrong that turn it into a problem. And when it's a problem, the cells create more myelin, and it becomes what's known as plaque. And at some point, there's too much plaque, and the little microglial cells that clean it up have gotten tired or have gone offline, or something has become broken in that biochemical chain. And this is a picture, artist's rendering, of what these synapses look like when they are clogged with plaque. We all know plaque is a bad thing. Plaque in our arteries is what causes heart disease. Plaque in our teeth is why we brush our teeth every day, to keep our gums healthy. Plaque is the enemy. Same kind of thing occurs in the brain. These microglial cells don't do a good enough job of cleaning up the brain. And there's an accumulation of this plaque, which gums up the transmission across these synapses. Now, one of the things that the brain does is function in several known rhythms. We've maybe heard of alpha rhythm or beta rhythm or theta rhythm or gamma rhythm. These are all natural frequencies of the brain that are caused by the electrical circuitry and the firing of the nerve cells across these synapses. And when the brain is healthy, all of this works very well. But with respect to the frequency or the group of waves called gamma, which is a frequency of between 40 and 100 hertz or oscillations per second, this gamma frequency is closely associated with attention, with memory, and with higher functioning. And when the synapses get clogged with plaque, one of the characteristics is that the brain frequency changes and it moves from gamma to another frequency, to disabled frequencies, to inoperative functioning. But again, it's that losing of the gamma frequencies that is characteristic of the brain being off, the rhythm is being off, and as a consequence, or part of the syndrome, is not being able to remember what the car keys are for. So, with these electrical impulses in the brain, when the rhythm is off, we're really broken because the brain is not functioning the way that it is intended to. Now, are there any questions at this point? I've been through a lot of quick view of how the nerve cells work. Are there any questions or comments at this point before we move on?
Ben and Jim, I know you had a couple questions. Do you want to ask those now or wait till the end?
Page slides. Whoops. Okay, we can hold on the questions until
Okay.
later. We have one of two more activities actually. Now we're going to play a game of fact or fiction about the brain and brain health. And in order to play this game, next slide. So here's what you'll need. How about starting with a degree in neurobiology? Well, that's okay if you don't have that. We can play anyway. But what we're going to do is go through a number of statements, and you can decide and let us know if your mic is open, whether you think it's fact or fiction. Are we ready?
Ready.
Here we go. My mother has Alzheimer's, so I'm likely to have it too. Yeses, nos?
Anyone want to
Wait,
venture a
everyone
guess
comment on
here?
that?
I see Neil and Ben say false, no. Stacy says fact.
Okay, well, actually, this one's false. The DNA, your DNA, does not determine whether you'll get familial Alzheimer's. It's actually, actual familial Alzheimer's accounts for about 5% of the cases. So just because mom has it doesn't mean that you're a likely candidate. All right, next question. Having good sleep habits can prevent Alzheimer's.
Feel free to unmute yourself or type it in the chat.
True. Fact.
A lot of trues.
True.
BB says false. Ben, Fazia, Rod, Michael, Monty, Stacy are all on the true side.
Well, it actually is true. Having good sleep hygiene and continuing to give the brain a chance to rest and rejuvenate turns out to be extremely important. But actually only about 1/3 of American adults are sleeping the recommended 7 or 8 hours per night. And if you're a working parent, you might be getting considerably less than that. But sleep is essential to good health, and it's essential to good brain health. Okay, next statement. Are we ready? Alzheimer's disease is one of the leading causes of death in the United States.
True.
I think I may have referred to this earlier.
Fact.
Ben
True.
says true. Everybody, a lot of trues here.
A lot of truth. Yes, well, it actually is very true. It's the 6th leading cause of death in America. It's the 3rd leading cause of death among senior citizens. And it has a higher incidence of mortality than both breast cancer and prostate cancer combined. It's a serious disease. Next fact. Silver dental fillings can be linked to an increase in Alzheimer's disease.
False.
Rod says false. Ben says true. Stacy says true.
I think Wendy just put her hand over her mouth so we can't see her fillings.
BB says false. Fazia says false. Kim says, question mark? Neil says I misspelled it. True.
False.
False. Silver dental fillings are not linked to an increase in Alzheimer's, and there seems to be no relationship between silver dental fillings and incidence of Alzheimer's. Let's do another one. Similar to habits preventing heart disease, living a healthy lifestyle will decrease the chances of developing cognitive decline.
True.
When you're ready. Of course it's true. The best chances of beating Alzheimer's disease is prevention. So live a healthy brain lifestyle. The items on the list are obvious and pretty much the same as for heart health, but maybe just a little bit different given that we're talking about the brain. Certainly quitting smoking is essential. Also eating well, having a good diet is important. but also exercising your brain. And exercising your brain in more than one dimension is important. Exercising your brain would be things like taking up a new hobby, or trying to pursue an interest that is not now part of your daily mix. These things tend to be important. And I would add to this, if you can make the things that you're doing somehow counter to the usual things you do, you will probably get more out of it, and your brain will probably be healthier. It's similar to the fact that those who have cognitive disease are given music therapy and art therapy, these things that call on the different parts of the brain and the different skills. So if you're going to pick up a new hobby, and that's probably a good idea almost at any age, but certainly as you age, pick something that's maybe a little out of character. Pick something that calls for different skills. And then, of course, exercise. Exercise is important. And healthy body, healthy mind. We all know that's true. We have one more. There's one more. True or false? There are only a few promising drugs in trial to cure Alzheimer's disease.
People say false, but Neil says, Ben says false. Neil says, well, if even just a few. Let me see. Feel free to call stuff out too, folks. Michael says false. Rod says true. Stacy says no cures. Ale says false. BB says false. Linda says true. Oh, you're revealed.
Well, I have revealed that it's false. Alzheimer's has no cure, and as I said, has no survivors. There are FDA drugs on the market to address some of the symptoms of cognitive disease, but there is no cure on the market. That's a daunting fact in my view, and one that led me to dive very deeply into Alzheimer's research to see where science really was with Alzheimer's. And in the next part of this presentation, I can talk to you about what I found and what are the benefits of light. Actually, it turns out, as hopeless as I've been sounding, there actually is hope. Scientists have been researching Alzheimer's for some time, and it's been known for all of that time that there's a relationship between sensory information that's critical to healthy brain functioning. Stimulation is important to the brain, that I think is clear and obvious, but to be therapeutic with that requires a lot more information. And one of the most interesting studies is being done at MIT, where the researchers showed that shining a light into the eyes of the subjects that flickered at one of these natural brain frequencies, at this frequency called gamma, which is 40 flashes a second, had a visible impact, and their exposure to the light was 1 hour a day for 3 to 6 weeks. And that demonstrated a reduction in the amount of plaque in the brains. And from that, I gathered that there's really hope. And this is one of those leads that leads to the possibility of a non-invasive potential therapy for cognitive decline. Because of that research, I decided to have somebody build a device for me that flashed at 40 hertz at this gamma frequency. And I brought it home and turned it on, and in a very short time, the physicians were asking me where they could get a device like this. So I figured that that was really a call to produce a device that would provide gamma frequency light that is one of the few flickers of hope we have in the world of cognitive challenge. To reiterate, it's not hard to do research on wellness routines for the brain, and the advice is universal. Let me repeat myself. Physical exercise, eat healthy, engage in healthy social activities with friends, and have mentally challenging activities. All of these things are important. It's also important to look at the stimulation that you give your brain, not just in terms of the major lifestyle issues, but sometimes the small things in your environment that can pay off tremendously. Things like some people find not having a cluttered house makes them calmer. Pay attention to the colors you use, and to the way things are working in your own environment, all that can accrue to rest and stimulation for your brain. And that's where I'm focused on this particular technique, on light therapy, because I've seen it work at home, and there's a lot of information to suggest this may be a major potential therapy for the treatment of cognitive disease because it's natural. It reinforces that natural brain frequency of 40 hertz. And this is a little picture of what our device looks like. It's important to think about the use of such things, because just like getting exercise, just like eating healthy, in order to prevent cognitive decline, one needs to stimulate the brain. Yes, learning a new language will be helpful, but also I have come to think of 40 hertz light as something like a vitamin for the brain. And it's something that all of us can use. In fact, during this entire presentation, I've had mine on my desk on 100% of the time, which is how I live, because I know 40 hertz light is good for me. So my team and I here at HomeoLux are really mission driven, along with the entire Alzheimer's community, with a determination to beat this disease. And right now, I believe the best chance one has of beating the disease is prevention. And that means healthy lifestyle, healthy sleep, healthy stimulation, and nourishing 40 hertz light for your brain. And now, let's take a minute and see if there are questions or further discussion. And if not, we have.
I think there may be a few questions. One sec, Terry.
Okay.
Linda F., I missed you earlier. Did you have a comment or a question?
Let's see. No, I don't. Can you hear me?
Yes.
Okay, great. No, I don't. I'm just taking all of this in and delighting and listening to it.
Awesome.
Oh, a happy receiver of information. Well, I'm delighted. Any other questions, comments? Kevin?
Sure. There was a question was what is the cause of death with someone with Alzheimer's? Is that Alzheimer's? Is that the approximate cause or underlying cause? Is there any pattern to the other issues people are having?
In my view, and I'm not a physician, it is an immediate cause, but not the direct cause. The direct cause tends to be a failure of the digestive system, of the nervous system. All of these things are run by the brain, of course. So I suppose finally the answer is yes.
Are there specifics about a recommended dosage or anything about how much light people should get to help prevent or to even ameliorate effects on somebody who already has the disease?
Well, the database of our users tells us that those who are using 40 hertz light at least an hour a day for 6 or 8 weeks generally report things like better sleep, better moods, better concentration, and so forth. What has pleased me so much is that 40 hertz light has gotten away from being simply a device or tool for the Alzheimer's community. And now all of those who are concerned about brain health, and certainly particularly those who have cognitive challenges or may think they have impending cognitive challenges, would want to use this technique also. But 40 hertz light, as I said, in my view, is kind of like a vitamin. We all know there are light-related health issues. Seasonal affective disorder is probably the most obvious one and the one that comes to mind. But again, 40 hertz light, the use of something that has one of the natural brain frequencies that has been demonstrated to be helpful is something I think is very important to all of us. And that's why we're on this particular mission that we are on.
Great. Monty asks, he has heard that there's similar benefits to sound at this frequency as well. Is that something that you've heard? Do you think that's true?
Yes, again, that sound is at the same frequency. It's that gamma frequency, that 40 hertz. Yes, the sound has been, in laboratory experiments, been deemed to be also helpful. So the combination of sound and light, one would think, would be a perfect combination. And we may have that at some point, but it's important to me that if we have the sound at 40 hertz and the light at 40 hertz, that they're exactly the same. So that's sort of our research that's ongoing. But to answer your question, yes, 40 hertz sound has been demonstrated to be helpful too.
Jim's got a whole bunch of questions. I'm going to pepper you with them in a second. Fazia asks, are there any 40 hertz natural lights that you can get, like a flickering candle or something that we would see in everyday life?
Not that I know of. There may be some around, but our research has indicated to us that we needed to really be very careful about how we produce those 40 flashes a second, and that's turned into an important piece for us. That's why we're so concentrated. We have such precise engineering on our 40 flashes a second. And yes, I think 40 hertz sound is also helpful. Putting them together is a question I'm still working on.
Fair enough. Jim has a bunch of questions about plaque. Does sleep apnea affect Alzheimer's?
I don't know the relationship between sleep apnea and Alzheimer's. And I probably would. I've been an apnea patient for a decade. But I do not know the relationship. I would guess, and if I could just simply guess, I would guess that apnea patients have a lower incidence of Alzheimer's because part of the apnea therapy assures good quality sleep. And we know
If it's
good
being
quality
treated.
sleep is important for a healthy brain. But I don't know of any actual research done on that specific question.
I don't think you would have any stats on this yet, but is there any indication as to the amount of plaque or a percentage of plaque that can be broken up with 40 hertz lights?
In the original studies done at MIT, and the target population was white mice who had been bred to have high levels of plaque in their brains. 40 hertz light reduced that plaque by half in a fairly short time.
Wow. Neil weighed in about the sleep question and says that untreated sleep apnea is a danger for Alzheimer's, and he recommends a book by Matthew Walker, Why We Sleep. And that's in the chat if you're looking for that. Jim asks.
Yeah, I think that's consistent with my answer.
Yes.
I'm pleased.
Yeah, if it's treated, it's less likely.
Right. That's right.
Are there any plaques that are actually large enough to be seen in an electron microscope or any other kind of microscope? Is that something you can actually visually see?
I believe so, but I couldn't point you to a source.
And would a gamma frequency be helpful in just regular aging memory loss, not necessarily cognitive disease? I'm sorry, I got that totally wrong. Does average aging memory loss involve plaque as well?
I can't give you a precise answer on that. In the studies that I've seen, plaque is a factor. Plaque seems to be an inevitable consequence of the metabolism of the nerve cell. However, the issue occurs when plaque gets to be too much plaque, or it changes its substance, and that's when we have disease. There's also various kinds of dementia. There's and those would have different indications of plaque, I suppose.
Somebody asks if the light can be useful with sundowning in Alzheimer's patients.
My guess is that's a different phenomenon, but the presence of 40 hertz light, and particularly if the brightness is adjustable, can certainly help in those transition times of day. And it's logical to do that. I've had some of that experience at home. And yes, I think in my own experience, the presence of the gamma light has been responsible for what I think has been a marked reduction in sundowning. That's my own personal experience. I have no data upon that, but that is in fact my experience.
I have a comment and then a question, and then maybe we'll take one more. So Neil says that the PET scans have been used to identify plaque in the brain. So just FYI. Fazia asks if there's a connection between Alzheimer's plaque, and any particular plaques on the glands, like the pineal gland, or is the plaque more found generally? Is the plaque found generally throughout the brain, or does it seem to be localized?
Well, the plaque that we're concerned about in Alzheimer's, known as amyloid plaque, seems to be the plaque that's associated with the synaptic end of the nerve. I don't know where else in the brain that plaque or other plaques might appear.
Excellent. Thank you, Terry. And I think our last question is just a personal one. Do you have an update on your wife? We'd love to know how she's doing.
Yes, I'm pleased to tell you, my wife is, as the doctors keep saying, remarkably stable.
Oh my goodness.
In fact, I said to her principal physician, who is a specialist in the area, who was here in this story, it was a year ago, last June, and I said to him at the time, Doctor, several years ago, I asked you how long you thought Lynn would have to live. And you said you thought about 2 years. And it's been 4. He said, yes, she's been remarkably stable. I said, I credit the gamma lights. He said, I can't disagree. Can I have your business card?
Very good. I have one last question from Linda. This is kind of an interesting one. Are there any physical effects that you would actually feel with the gamma light therapy? Would you, Linda says she feels like she has felt tingling on her scalp sometimes when she's used it.
I've not heard that, and I've not heard anybody report those kinds of physical symptoms. With a flashing light, the thing that sometimes occurs to people is what's called a photo-triggered epilepsy, which is seizures that can be triggered by flashing light. That light tends to be at a much lower frequency than gamma. That appears in the 10 to 20 hertz range, and is incidentally the reason that you've never seen season 1, episode 38 of Pokemon.
I've heard that.
And that's because in season 1, episode 38 of Pokemon, at about 2/3 of the way through the show, where good confronts evil on a background that was changing between red and blue at 14 hertz. And by the time the show was over, hundreds of children had been admitted to emergency rooms. But that's way down the other side of the spectrum. 40 hertz would not be expected to have anything like that. But in terms of tingling of the scalp, not reported to me so far, but it's an interesting comment. We should try to look for more of those.
Terry, we're almost at 15 past the hour, so I think you've done a stellar job. Thank you so much.
Well, I hope I haven't confused everybody. I know that there's a tradition here at BlakeSt, which is to leave you with a challenge. And I have a challenge for you. And here's the challenge. Breathe well, sleep well, eat well, exercise your body, and nurture your brain with 40 hertz light.
Awesome.
Terry,
thank you so much.
Kevin, thank you. And it would be a pleasure to hear from anyone.
And you got the website right there. Thank you, Terry. And thank you, BlakeSt House. Thank you, Shay and Taylor, as always, for being our hosts. BlakeSt House is based in Bentonville, Arkansas, as part of the Walton family's efforts to make a more dynamic and interesting community for everyone. So we always thank them for their hospitality, and thank you
Kevin,
for
I'd like
being
to
us great
thank,
people.
I want to thank you and everybody at BlakeSt for all the help and the enthusiastic encouragement in inviting me here. And I hope you found it interesting and I hope useful. Good night.
Excellent. Good night. Thank you all.
Terry.
Thank
you,
you.
Terry. Good night.
Thank you, thank you.
Thank you.
Thank you, Terry.
Thank you.
Good night, all.